So recently, I got the privilege to work with some really cool students at another organization that's really well affiliated with IMO. And our project was to figure out how to identify patients in their basically data warehouse that they've custom built up. And Dr. Heindel, this is an Ehlers-Danlos syndrome phenotype cohort that we were working on. Well, if you look at the standard code systems, and that's what we utilize to kind of like run queries against this tech stack. Standard code systems are big buckets of information. You just can't say, "Hey, I want to use this ICD-10 code," or "I want to use this SNOMED code." You're just going to get millions of patients back, depending on the size of the patient pool that's utilized in that environment. And so what we did is we did exactly what we wanted to do, was go through the symptoms of these patients. And so we actually used Mondo from IMO. We found out what is the diagnosis, or what is the possible diagnosis, and then we went to Mondo, and then we used the histophenotypes, and we used that to help us describe the patient. So we used the description of how the symptoms of the patients in this population to retrieve it. And that's what is hard to describe to a clinician, is because our training is so different, but you need to approach these patients with not just like, "Hey, I think this is like this patient." You have to look at the symptoms behind the scenes. And so what Mondo has really provided us is, with the meaningful research behind the scenes, they've given us the evidence at the point of care that we can go and see what is fundamentally going on symptomatology with these type of patients. And it's such a powerful exercise that we tried this out with, and we're getting some great results in that query and in that cohorting.